Welcome to Ulosca channel. Access all nursing practice questions. Multidimensional Care I practice questions with answers.
Question 1. A nurse is assessing a client with heart failure. Which of the following findings requires immediate attention? A. Bilateral leg edema. B. Weight gain of 1 pound in a week. C. Shortness of breath at rest. D. Fatigue during physical activity. Which one is the correct answer? The correct answer is C. Shortness of breath at rest. Explanation. Shortness of breath at rest indicates severe fluid overload and potential respiratory failure. It is a critical sign that needs urgent intervention. Question 2. Which nursing action is most appropriate when administering a subcutaneous heparin injection? A. Aspirate before injecting. B. Massage the site after administration. C. Use a 25-gauge needle and inject at 90 degrees. D. Administer into the deltoid muscle. Which one is the correct answer? The correct answer is C. Use a 25-gauge needle and inject at 90 degrees. Explanation. Heparin should be given subcutaneously using a small gauge needle at a 90-degree angle, without aspiration or massaging, to reduce bruising and tissue damage. Question 3. A client is at risk for falls. Which intervention should the nurse implement first? A. Keep all lights off at night. B. Place the call light within reach. C. Restrain the client in bed. D. Keep the side rails up at all times. Which one is the correct answer? The correct answer is B. Place the call light within reach. Explanation. Ensuring the call light is within reach promotes patient independence and immediate access to help, reducing fall risk without compromising freedom. Question 4. What is the priority nursing diagnosis for a client with COPD experiencing dyspnea? A. Risk for infection. B. Anxiety. C. Impaired gas exchange. D. Activity intolerance. Which one is the correct answer? The correct answer is C. Impaired gas exchange. Explanation. Impaired gas exchange is a direct consequence of COPD and dyspnea. It poses an immediate risk to life if not addressed promptly. Question 5. Which lab value should a nurse monitor for a client receiving warfarin? A. Hemoglobin A1C. B. INR. C. Platelet count. D. WBC count. Which one is the correct answer? The correct answer is B. INR. Explanation. INR measures how long it takes blood to clot. It's essential for safe warfarin dosing to prevent bleeding or clotting complications. Question 6. A nurse is teaching a client with newly diagnosed diabetes mellitus. Which of the following statements indicates a need for further teaching? A. I will check my blood sugar daily. B. I can reuse my needles if I clean them. C. I will rotate injection sites. D. I should wear shoes when walking. Which one is the correct answer? The correct answer is B. I can reuse my needles if I clean them. Explanation. Reusing needles, even if cleaned, increases infection risk and damages tissues. Proper technique requires single use of sterile needles. Question 7. Which nursing intervention prevents complications in a post-op client? A. Encouraging the client to remain in bed for 24 hours. B. Restricting oral fluid intake. C. Encouraging incentive spirometer use every hour. D. avoiding leg exercises. Which one is the correct answer? The correct answer is C, encouraging incentive spirometer use every hour. Explanation. Using an incentive spirometer helps prevent atelectasis and pneumonia by promoting lung expansion in post-op patients. Question 8. A client is placed on contact precautions. What PPE should the nurse wear? A. Gloves and gown. B. Gloves only. C. Mask and gloves. D. Gown and mask. Which one is the correct answer? The correct answer is A. Gloves and gown. Explanation. Contact precautions require gloves and gowns to prevent the transmission of infectious organisms through direct or indirect contact. Question 9. Which of the following best describes informed consent? A. The nurse explains the procedure in full. B. The client signs a document without understanding. C. The provider explains risks, benefits, and alternatives. D. The family gives permission. Which one is the correct answer? The correct answer is C. The provider explains risks, benefits, and alternatives. Explanation. Informed consent involves the provider clearly explaining the procedure, including risks, benefits, and options, so the patient can make a knowledgeable decision. Question 10. A nurse is preparing to administer digoxin. Which assessment should be performed first? A. Check blood pressure. B. Check apical pulse. C. Check temperature. D. Check respiratory rate. Which one is the correct answer? The correct answer is B. Check apical pulse. Explanation. Apical pulse must be checked before administering digoxin to ensure it's not too low, as digoxin can lower heart rate further, leading to dangerous bradycardia.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.